Hello, my name is Joe Murray. I'm a gastroenterologist at the Mayo Clinic in Rochester, Minnesota. Today I'm talking to you about a paper that will be published in the Mayo Clinic Proceedings, January 2017. It's entitled Less Hidden Celiac Disease but Increased Gluten Avoidance Without a Diagnosis in the United States. Findings from the National Health and Nutrition Examination Surveys from 2009 to 2014. This study, conceived by our colleagues at the NIDDK and ourselves, really aimed to study celiac disease in the U.S. population. The NHANES surveys are the best survey or sampling of the U.S. population. This 6-year study was divided into 3 2-year periods. And in this paper, we examined the trend over time of celiac disease, both diagnosed and undiagnosed. In the earliest part of this study, most patients or people with celiac disease in the United States remained undiagnosed. However, the last 2-year period, 2013 to 2014, that proportion of undiagnosed celiac disease had dropped to less than 50%, suggesting perhaps that we were, as a profession, were finding a greater proportion of the people with celiac disease. Why did this happen? I mean, could be better tests, more awareness of the disease. In this figure from the paper, you can see that the proportion of undiagnosed celiac disease has shrunk substantially. The group with celiac disease that's been diagnosed has increased, but the largest increase is in the proportion of people who have avoided gluten without a diagnosis of celiac disease. What's hiding in this proportion? We don't know, because we did not, when we conceived of this study, we had not been aware of this, or at least there hadn't been this tremendous trend or fashion for avoiding gluten for perhaps other reasons. So that remains somewhat of a, let's say, black box, but probably within that group are people who have undiagnosed celiac disease and somehow or other have figured out to start avoiding gluten. So it's also possible that this undiagnosed celiac disease has become, let's say, undiagnosable because people have already started to avoid gluten without a diagnosis. So what message do I think comes from this paper? First, we're finding more celiac disease. We're diagnosing more celiac disease. And secondly, we need to test people before they go gluten-free in order to be able to make an accurate diagnosis of celiac disease. And that's really a message that's not just pertinent to us in healthcare professions, like gastroenterology, for example, or internal medicine, or the primary care, but also to the general population. If you are thinking about avoiding gluten, please, and you have symptoms, please see your doctor and get tested for celiac disease first. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.